Sure.
You do have a rock-solid background, and I wanted people watching the show to know that your credentials and your background.
Right, I'm a conventional MD with specialty training, and I've spent much of my time in Arizona at level 1 trauma hospitals. So I'm in the blood and guts and center of medicine.
In the trenches.
In the trenches. And on the cutting edge, because while I was in training, I started before we had body computed axial tomography, before we had MRI at all. And I specialize in those two things now. So I've seen an evolution, and it's a huge evolution, but compared to what I believe is going to happen and hope will happen, the stem cell evolution, which has had a rocky beginning, but once it gets going, I think it's going to increase our ability to deal with some very difficult diseases, but moreover, it's going to cut the cost of medicine. We're dealing now with a problem, and that is that healthcare costs our country 18% of our GDP, or about $2.5 trillion a year. And the problem with that is that, you know, many proud Americans might think to themselves, well, we spend a tremendous amount of money on medical care, but look at, we have the best medical care in the world. Well, that's not true. If you want to look at it scientifically and not emotionally, you have to look at the World Health Organization epidemiological study that has shown that if you take the health of our citizens, which is probably one of the better parameters to look at as far as how effective is our healthcare system, well, the healthiest citizens, epidemiologically studied, is a pretty good measure. It's an outcome-based measure, which you hear a lot about these days, and we come in 73rd behind 72 other countries. Now, each one of those other countries that come in better at the health of their citizens pay vastly less than we do per capita for that health care. So there's a problem here. The problem is we spend too much for the medical care and the effectiveness of the medical care that we give. And I believe the solution will be adult, not embryonic, but adult stem cell therapeutics, the kind which I've been involved in Central America. I was the chief medical officer for a publicly traded company doing these therapies overseas.
So what you're saying basically is truly curing the disease with adult stem cells rather than what we have conventionally is treating the disease in some cases.
Let me just give you a concrete example. If you have multiple sclerosis in this country, it costs you about $40,000 to $50,000 a year, or it costs the government, or it costs your insurance, but that's the
which
cost
costs everybody.
Which costs everybody, of course. $40,000 to $50,000 a year for the immunomodulatory drugs, which we know have been studied very, very well and conclusively only gives you a 30% improvement in your neurologic status.
But not really curing the disease.
True, absolutely.
Treating the disease.
Absolutely, your point is well taken. But even if you just treat a disease, if you're, as we have with adult stem cells, have gotten to the point where we're getting a 70% neurologic response rate in a life-changing, lifestyle-altering neurologic improvement, we're doing that for about $15,000 to $30,000, one or maybe two-time treatment. And then no more. We've gotten a lot of patients off their immunomodulatory drugs. I'm not, please, I got to say this soon, I'm not advocating going overseas to get stem cells. The whole idea behind my book and behind getting this word out is to try to get people to understand the answer to our healthcare cost crisis is to bring this kind of treatment here in this country so that our fine doctors can focus on it. And if they do that, it will yield very quickly. It's the low-hanging fruit is very abundant at this stage of adult stem cell development.
Now, that being said, the term adult stem cells, people are not as familiar with as what we hear all the time on the talk shows, embryonic stem cells.
Right.
So let's clarify that for the viewer right now.
Sure, absolutely.
So that they'll have an
embryonic
understanding.
stem cells are cells that are never found in a person who has already been born. They're only found in the very early stages of embryologic development. And each one of those embryonic stem cells can make an entire baby. All 120 cell types that are in the human body can be made from an embryonic stem cell. Now, as far as the development of the embryo is concerned, that's a magnificent thing. In fact, that's cell growth at a rate that isn't seen in anything else in biology. Even cancer doesn't grow that fast. You cannot, there's no cancer in medicine that can make a 7-pound tumor from one cell in only 9 months. It's just, it's just ferociously fast growth. But under the biological controls of the embryo, that's not a problem. But when you take them out, they immediately become cancers. And so all the science that's applied to them, and still is to try to stop them from making cancers in order to take advantage of the fact that they can make all the cell types.
Sure.
Now, in the last 10 years only, in the gold standard peer-reviewed medical journals, they have put forth evidence that there is a healing adult stem cell system in everyone's body that lives in our bone marrow and is putting out cells that go and heal any injury in any organ of our body. And this is going on 24 hours a day, 7 days a week, from cradle to grave.
Right.
And what I'm trying to say is that this is a quantum leap in medical science, the likes of which we seem to only see happen about every 100 years, cyclically. You go back 200 years, we had the discovery of the immune system by Dr. Edward Jenner and others.
And we talked about that.
And others.
Via email. And others.
And others who discovered there is this system that protects us against viruses and bacteria and cancer cells. And vaccine medicine was developed and has saved vastly more lives than anything else you can point to, and eliminated vast human suffering and improved the human condition. Such that we didn't see another development of that magnitude till 100 years ago, or 100 years from that, when Alexander Fleming discovered penicillin, another naturally occurring evolutionary reality in a fungus, okay, that was doing what it was doing before humankind stood up on its hind legs.
Exactly.
Okay, so now 100 years later, in the first decade of the 21st century, we have discovered there is also this other system, this other natural evolved system that replaces cells that get damaged in our brain, in our liver, in our heart. Wherever there's damage, the damage actually puts out a chemical signal that tells our bone marrow, make more adult stem cells and send them into the blood. And we can measure that the adult stem cell number in blood goes up, just like you can measure a white blood cell count.
Well, let me ask you something, or throw something out to you, and let me know if I'm wrong. So when they harvest bone marrow from one human being, where there's like a match for bone marrow to cure another human being, is that really the cells that work there? When you infuse or induce that bone marrow into someone?
You've landed on a complicated situation.
Leave it to me.
But I'll try to run through it quickly.
Please.
We always talk about matching cells, all right? And what you have to realize is that your immune system lives in your bone marrow. And the most valid use of a bone marrow transplant is if a patient has cancer, especially leukemia, because that's cancer of the blood and it's cancer of the bone marrow.
Yeah.
So we wipe out the bone marrow completely with radiation treatment or chemotherapy. Well, the problem is the patient will die very quickly with no immune system, no bone marrow, so we must replace it, okay? Well, when you replace it, you've made a new immune system that's not the patient's immune system. Whoever they got it from. That's why they like to HLA match them the best that they can.
Right.
When they can't get a good match, decades and decades ago, they found, well, you know, we can take umbilical cord blood from a normal delivery. The baby goes home with mommy. We take the afterbirth, take that cord, take the baby's adult stem cells that are in it, and put them into the patient that's had their bone marrow destroyed, and regrow a whole new bone marrow. And that's exactly what the therapeutics of adult stem cells is. If something's broken, we can put in cells that will repair it, which is why I'm never very impressed when people tell me, not that it isn't okay, it's just very peripheral, and I want to bring this to the center of medical attention. But when they tell me that they've grown some tissue that they can put here or there, it's like, okay, but your body will do that automatically if you just put the cells in the blood where they operate. They operate from the blood.
Right. So rather than, and I think we've all seen it like on PBS, the little mouse that has the ear grown on his back.
How many ears do you need?
Yeah.
I mean, we need treatment for strokes and for multiple sclerosis and any brain disorder or liver disorder.
Right.
If someone gets cirrhosis and all their hepatocytes are destroyed, we can put new hepatocytes in there simply by taking vibrant, robust adult stem cells, just put it in the blood.
Sure.
And then they will be attracted to the damage.
And are we taking it from